more me just touching on some of the key highlights from them, just so you hear them in the future. But of course, every chapter we do, we'll spend time in each of these organ systems. That's the whole point of the anatomy chapter. So that's what we'll do. But the first chapter just kind of gives us a summary of them. So mic check. Okay. So let me get back to that section there. Urinary system, what was it? Oh, nervous system. So page 6 is talking about some of the other organ systems. So again, I'm just kind of summarizing the main point of these organ systems so you hear it in the future. Like I made the point earlier about the skeletal system. If anybody remembers from the first day, I know this is asking a lot to remember this, but the first day, the skeletal system has something that's really important. The bone marrow, right? Bone marrow helps us make all of our red blood cells, or not, excuse me, let me just rephrase that. All blood cells. So that's an important anatomy thing to know, because people that have bone diseases that eat away how much bone they have, things like osteoporosis and stuff like that, you've probably heard of osteoporosis before, that can affect their bone marrow and thus affecting their blood counts. You see this rabbit trail now of these organ systems and why some of them have these key functions that are so important. You never want to forget how important bone marrow is for like your general, being aliveness, if that's the right word. But tracking over to page 6, nervous system. So highlight importance of nervous system is really, nervous system is our brain and our spinal cord and all the nerves. What do you think it does? Controls us. Page 6, this is page 6. Controls us. Without the brain, usually you're just not alive. Brain death is death, okay? If your brain is not functioning, you're not alive, okay? It's another word for you, zombie, I don't know, something like that. So unfortunately, we can't operate or function without the brain working. So the brain is the control center of the whole body. Has a lot to do with how we sense the world around us, and memory, which makes us, higher functioning cognitive beings to have high level thoughts and memory. That's what makes the human brain advanced. So the brain is all, and the nervous system is all about control and the control center, the power, regulating everything, that sort of stuff. A system that's very close to it, which will be Unit 3, is endocrine. Our endocrine system produces hormones. It kind of does the same job as the nervous system. They are very closely related. This is the system that's in the book right next to this one. They control each other. They're pretty closely related. Endocrine is about exerting control as well. They just do it a different way. Nervous system is all about electricity and neurons and firing and quick. Endocrine system is all about controlling stuff slow with hormones. And no, not the hormones you kind of think of as traditional, like, hormones and pregnancy and all that stuff. I'm talking about hormones you have to have every day to live. Hormones that help us control blood sugar regulation. Key one, insulin. And some people in here have heard of insulin before, probably, right? Insulin is not a medicine. Insulin is a hormone. We've just made it into a medicine. Before insulin was able to be synthetically made into a medicine to give to people, if they had type 1 diabetes, guess what happened? They died. There was no insulin. If they couldn't make insulin, they're dead. So that's why diabetes is a very costly disease overall still in modern day. So there's hormones that we can't live without. That's the endocrine's job, and it does control us. Cardiovascular, they call it the circulatory system in the book there. I mean, that's cardiovascular. That's our heart and all the blood vessels attached to it. That's our information highway. It does a lot of controlling, but all these systems you'll see relate to each other. The main role of the blood is to get stuff from one place to another. Get waste things from somewhere to maybe the urinary system to get rid of the waste. Bring oxygen from the lungs to wherever they're supposed to go, all over the body. So it's like a highway. I always look at the blood as the pumper and all the blood vessels at the highway of the body, getting stuff from one place to another, okay? There's not really a way for things to travel very quickly in the body without getting into the bloodstream. This is why medicine, like intravenous medicine, works so much faster, because I'm putting it directly into the highway. If I take a pill, it's got to get absorbed in the stomach, and then it's got to get to the bloodstream, and then it goes and does its job. So the bloodstream is the highway. It carries stuff from point A to point B, and that's what the heart and all the blood vessels, part of that cardiovascular, also known as circulatory system, is all about. Digestive system, that's pretty simple. What do you think that's for? Digestion. Absorption of food. Digestion is absorption. Breaking down food and turning it into stuff we need. there's most everything in your life you're going to have to either drink or eat it to survive. So theoretically, it's like whatever it is, 3 or so days without water before you're dead, 21 or 30 days. I mean, theoretically 40 days, I suppose, without food before you die. So those are kind of vital. The digestive system just as vital as any other organ system, but it's all about break down food, absorption, nutrients, that sort of stuff. And then the last two is really, there's nothing really to say. The last two is just highlighted in the book was male and female reproductive systems, which they're pretty simple what their role is. I mean, it's in the name, right? Reproduce. Just throwing it out there. If you didn't know what that was for, I don't know. So that's kind of the whole point of those systems, to make a new person. So pretty straightforward. So again, here's the vocab question I've got in here. Again, I like asking questions always just to say, hey, what's it like to look at a test question? How do test questions word stuff? What are they looking at? So this was a tough one because this was back from, this is on page 5, so you may not know this one. But there's only one of these systems that does really anything with the immune system, the immunity of our body, which immune cells are cells that help fight off infection. But if you didn't know that, my point with this is you could probably get to the right answer by eliminating stuff you knew for sure didn't have anything to do with immune cells, okay? So let's look at the question that way. The first thing I told you guys about questions is you got to figure out what the question's asking you. This question's asking you which organ system. So automatically you go, okay, organ system. That's what I'm looking for. Helps the body with immune cells. So I'm looking for an organ system that does something with immune cells. And then I look at my answer choices. And that's your first step. Look at what the question's asking you. Then you look at the stuff of the answers. Look at all of the answers so you can eliminate things that don't fit. Okay, integumentary system, the first one. What's that? That's skin, hair, and nails. Okay. Probably, does that have anything to do with immunity that you think of? It offers protection, but I don't know that it makes our cells at all, does it? No. Okay, it doesn't make cells or help with... So that can go out. That's probably unlikely to be answering this question. Okay. I'm actually going to skip around a little bit for a reason, obviously. Number 4 down there, the nervous system. Does that sound like it would do anything with it? Cells that fight off infection, immune cells? No. Probably not. Control center, electrical impulses? Probably not. So now I'm eliminating answer choices. Endocrine system. Endocrine system's all about control through hormones. Probably not. Maybe. Immune cells, if it's all about control, it could be. So maybe you got stuck here. And then it's just a 50-50 shot. But at least you got a 50-50 shot and not a 25% chance shot now. Because you've eliminated 2 stuff that you're pretty confident has nothing to do with immune cells. What is the answer? Anybody? It's lymphatic. So our lymphatic system is a secondary system that's main role is to help with fluid, and its main role is that. And the book mentions it. But again, this question is only here not really to like freak you out that I'm going to ask you questions about every organ system. It's really just to practice kind of thinking through, eliminating what you know. You got to take what you know and stick with that and eliminate answer choices so you get them out of your way and don't get slipped up on them. But ultimately, I think for most people, the big problem with questions is confidence. Be confident. Be confidently wrong. That's fine. But just be confident. Don't second guess yourself, because I promise you, if you're a person that second guess yourself on a test and you change a lot of answers, typically the people that just make a choice and stick with it tend to do a lot better on my exams, and that will get you a lot further. I'd always rather be wrong and just totally miss the concept than be all over the concept and change my answer because I wasn't confident. You know what I mean? So sometimes in nursing, it's fake it till you make it a little bit. So if a patient asks you something in a room, or if it's your first time doing an IV on someone, are you going to tell the patient it's your first time ever doing an IV when they ask you? No. Listen, I'm a moral person. There's sometimes you tell lies, and there's sometimes you tell fibs. That's a fib that you need to tell. You act confident, and you tell them it's the whatever time. So that process works on testing. You just be confident. I know what I know. I'm unsure of this, but I'm not going to second guess myself. My heart, and I feel like it's this answer, pick it, stay with it. So far, organ system, key function, protection, temperature regulation, and sensation, meaning like feeling things or we're getting sensations from the world around me. What do we think summarizes that? What do you think? What, number 3? People agree with that? Integumentary system. That's the skin and everything else. That is the skin. This one too could throw you off. My point with this question is just to say, hey, you got to read the whole question. Because if you just read real quick and you stopped right here, what might you pick if you just read protection real quick and picked some answer? What would you go with? Skeletal probably, right? And you'd be wrong because you didn't read the whole question. So the big point they teach you with question stuff, and it is, so it's integumentary. It's our skin. Our skin can sweat to help cool or change our temperature, and we sense the world around us, like feeling, stuff like that, sensation. I tell most people, with test questions, I leave those up there because I don't want to hone in that you need to know everything about all 11 organ systems already. That's not where I'm at. My point is just, how do you start eliminating stuff, what you know? And I would gather, too, that you guys know more about the anatomy of the human body than you probably think you do because you're exposed a lot more these days. There's social media, there's stuff. You've heard stuff out there. Maybe it's not always accurate stuff you've heard, but you've heard things enough to have a general understanding of some stuff you think you don't, okay? We're just going to try to get it as accurate as we can and as specific to nursing as we can. So, page 7 starts our journey into the rest of the chapter with stuff you might have not heard before. But chapter 1 is foundational as far as it's got a lot of words we just kind of have to know that you're going to use later in nursing, and so we just can't ignore a lot of stuff from chapter 1. So anatomical terms. First things first, notice how this woman in this picture, and it's in your book on page 7, how is she standing? Standing in a very specific way. She's standing straight upright. They would call that erect. Erect just means upright or standing like upright. Feet are forward, right? And look at her palms. Like palms out, palms facing forward. You see this? The position they have this character in is called anatomical position. This means that everything you think about when you look at a patient, they may be laying in bed or hanging from the rafters upside down. If they are, I hope you're okay. But I've seen some weird stuff. I wouldn't put it past the patient to hang from the ceiling. You never know, okay? I've seen weirder things. So, however that patient is positioned, in bed, on the floor, hope not, whatever. When you're looking at a patient, you think of everything as if they are in an anatomical position. That's how you document things. That's how you think of them, okay? So everything in your mind's eye needs to be anatomical position, them standing upright with their palms forward. That's anatomical position. And that's how we get directional terms after that. Everything is thought of as a person laying here like this. So if they're in bed, they're upside down, they're in a chair, it's all the same. It's imagine them standing erect with their palms forward, standing upright like this. And so you notice something too, the left and right here. This is the patient's right and the patient's left. And that's how we think in medical field. Right? Because think about it. If this is my patient, my cart's my patient, and over here's their head, right? And here's their feet. Well, if I'm going by my right and left, well, that's my right, this is my left, so their right arm's over there. You see what I'm saying? That's going to mess up. What if the next nurse comes in, they're standing on this side of the room when they're talking to the patient? That might throw everything off. So it can't be based on the assessing person. It's always based on the patient's position, the patient's right or left. So keep that in mind when you're thinking of this too. Anatomical position is what we're imagining they're in and how we relay information, and it's always to the patient's left and the patient's right. Oh. That makes sense so far? We track on that. A lot of you have heard this before probably if you worked in healthcare at all, but that's like if I walked in to do a blood pressure for some of my CNAs in the room, right? I wouldn't document I did blood pressure on their right arm just because I was on that side and I said it's their right arm or their left arm, not mine. Okay, and so some terms that are here. One thing the book highlights is it has like a little dotted line that goes right down her head. So in between your eyes, straight down your nose, dividing you right down the middle, they call that midline. Midline. And it's just a point on someone's body to give us some direction. I'll write it bigger. Midline. That dotted line down the middle. That's midline. So everything on everybody, if I just drew an imaginary dotted line right down your forehead, down my nose, straight down, that's a midline. And so some terms are set around that. Basically what the book is making the point is that these terms are groups of opposites, basically. We have a term to tell us to look one way and a term to tell us to look the opposite way. And they just have a relationship like that. So medial and lateral. So always remember medial. Medial is always going towards midline. Towards midline. Not midline, but going that way, okay? So, for example, let's just say, let's say this woman has a little bit of an incision or a wound or something on her stomach, okay? If it's closer to her midline, you're just going to say this is a midline or medial, a medial incision. So that tells someone that their eyes need to go towards the midline to find this incision, towards the midline to find whatever you're marking as medial. If it's lateral, it's the opposite. Lateral is talking about outwards, okay? Lateral, like a lateral in football for any football fans in here. Some people don't register that if you don't understand football, and that's fine. If someone gave me a soccer reference, I'd be lost. I get it. So, a lateral in football is where they basically pass the ball sideways. It has to go behind them a bit, but that's what a lateral basically is, a flip sideways with a football. And so that's what it is. It's a sideways movement, away from midline. Lateral is moving away from midline. So if they had an incision and I wanted someone to look more on the lateral side of their body, I'm going to say, oh, well, they have an abdominal incision that's lateral. It would probably be somewhere over here, but my eyes are just going to go that way and look. So away from midline. It's going away from midline. If it's right in the middle, then you would probably just say midline. A lot of times for big abdominal surgeries, they'll do a big midline incision straight down the middle. And you've probably seen some scars, or you might have had a surgery. You might have a scar like that. Midline incision straight down the middle. So you would just call that midline. But if it's anywhere off that midline, it's like, what am I talking about? If it's closer to midline, I'll say medial. If it's further away. And I always remember medial and like closer to midline because medial starts with an M, midline starts with an M. So I know medial means I'm heading towards the middle. I'm heading towards the midline, okay? That makes sense so far? That's pretty straightforward. Okay, I'm going to rock your world now. Not really. No, but this one really messes people up. So I'll keep this up here. Okay. This one kind of messes people up a little bit. The other ones on that same page, on this front-facing anatomical position, is called proximal and distal. This one tends to mess people up, but so proximal and distal are interesting. You can only use proximal and distal when you're talking about extremities. And so let me define that word for you. Extremities is talking about someone's arms or legs, okay? They're like of the extreme, on the outside, basically. Basically, we call them extremities or appendages because theoretically, like Torso Terry here, he ain't got no legs, Lieutenant Dan, okay? No Forrest Gump fans? All right, whatever. You guys are boring, fine. He's got no arms or legs, okay? Theoretically, we can live with a torso because there are no vital organs in our legs or in our arms. Now, I'm not saying it's fun to live without those things, but theoretically, as a core person, our torso is all we need. We can live without the legs, live without the arms. So they're extremities. They're on the outside. They're appendages attached to us. And so distal and proximal can really only be used for that or different tubes we have in the body. And you say tubes, what do you mean? So tubes in our body would be, you could include our intestines in that. Our intestines are just a series of tubes really kind of starting in the mouth and doing a bunch of different loops all the way to the other end, okay? That's a tube. There's other tubes in our body that start somewhere and end somewhere. And so that's really all you can use proximal and distal for, and that's mostly what they use it for, but I'm trying to teach it for the extremities, for the arms and legs, just so it makes sense. So what proximal and distal is proximal is closest to the point of attachment or the point of origin. And what does that mean? So where do you think that the leg's attached to the body at? The hip, right? Anatomically, it takes the bone of your femur, the top, big bone of your thigh there, plug it into your pelvis to make the hip joint. So yeah, so basically the attachment point for the legs is here, where my hips are. Attachment point for my arms, where are they attached to my body? Torso. Shoulder, just the shoulder is fine. Layman term, shoulder. So that's your point of origin or point of attachment. So what proximal is saying is I'm looking at a direction that's closer to the point of attachment of origin, okay? But here's the caveat, and this goes with all these terms. Because they're opposites, it depends on how you're comparing them. If you want to get exactly, depends on what landmark you're comparing them to, okay? So, depends on wording. We'll look at a question later. Say this poor lady's got a big gash on her right thigh, okay? Right there where I did the black line. Depends on what I'm comparing it to. If I said, hey, she has a gash or an open wound, whatever, on her right thigh that is proximal to the hip, well, then I'm going to kind of look somewhere probably in this area, right? Close to the hip joint. Okay. If I said it, worded it differently, though, what if I said she's got a wound that's proximal to her knee? You see the wording there, to her knee? It doesn't. The wound hasn't changed position, but I'm wording how I'm saying it. So that means that I'm comparing something to her knee as a landmark, and that means I'm going to look somewhere that's closer to the point of origin than her knee. Her knee is further away than that incision on her thigh or that cut. When you consider the knee further away from the hip than that cut? So it's about what you're comparing to, okay? So I'll be write it out. It makes some more sense. So you see some landmarks that people use on the legs and stuff. Elbow, the knee, the ankle, stuff that we all know names for. We know a general area where those are. Cut on my shin, okay? Let me think on what word it. Incision, right shin. I'll just say shin. I won't say what. Right shin is proximal to the ankle. That right shin incision or injury is proximal to the right ankle. Given the principle, distal, I didn't really say define distal, but it's in the book. Distal is just the opposite. Proximal means I'm closer to the point of attachment or origin. Distal means I'm going further away from the point of attachment or origin. That's what distal is, like distance. Distal distance away. So if I said this statement, they got an incision on the right shin, that is proximal to the right ankle. Is that true or false? I heard true. I'm going to give you nothing with this face. Proximal means I'm close to the point of origin. Distal means I'm further away. There is no exact thing. The reason these opposite terms is, how do you determine where you're proximal or distal? You can't determine it. There's no like imaginary dividing line. It's about what you're comparing to. So look what I'm comparing to. I'm saying that this injury on her shin is proximal compared to the ankle is what I'm saying, to her ankle. It is true. This injury is closer to where her hip is, the attachment point of the leg, than her ankle. Would you agree to that, right? Yes? Okay. So now I'm saying that it is proximal to the ankle. It is closer to the hip than the ankle is. Look at the distance. So that's all proximal and distal are talking about gives me a directional term when I compare it to a landmark. In this case, the landmark I'm comparing it to is the ankle. I cannot move this wound and change the wording by doing this. Wound has not moved, but I change what I'm comparing it to, so now that changes the term I need to use. Because would you agree that that shin wound now is further distance away from the point of attachment than her knee? Yes, right? It's further away than her knee is to the hip, correct? So the wound never changed, but it's about what you're comparing it to. And that's really with any of these terms, because there is no exact line where all of a sudden I'm exactly medial or I'm exactly lateral. You could say something like this. I was talking about that incision with the stomach with medial and lateral. What if they had like a birthmark? Let's say they had a birthmark right here and then an incision right here. I'll color in the birthmark. Birthmark's colored in. That's a birthmark. And they have an incision that's just this line right here. Okay? That incision, I would say, is relatively medial. But now I have a landmark to compare it to. So I could say they have a right abdominal incision that is medial to their right abdominal birthmark, okay? Or I would say they have a birthmark that is just lateral to their incision. See, I changed what I'm comparing it to. It means I have to change the wording. It's all about your landmark you're comparing this stuff to, so people can reference that and find it, okay? So distal and proximal have a definition word, but they're not exactly. It just means what you compare it to changes it. But I didn't change where the wound was. I never touched this wound. The wound is still on her right shin. I just changed what I was comparing it to. I was either looking at her knee, I was looking at her ankle, one of the two, to figure it out, okay? Is that blowing everybody's mind? Are we okay? Proximal and distal really mess with people for some reason. I don't know. Just know if I'm getting closer to like the shoulder or hip, the point of attachment for my extremities, then I'm getting more proximal. If I'm getting further away from the shoulder or hip, I'm getting more distal. It just depends on the wording, what it's compared to. If it's compared to the knee, the ankle, the big toe, I mean, I would argue the most distal part of your foot would probably be like the tip of your big toe. That's like as far away from the point of attachment as you could possibly get. Does that make sense what I'm saying? The closest you could get would be the hip or like your upper thigh, something like that. Like right there would be as close proximal as you could get. But it's not exact. You can use the word depending on what you're assessing and what you're looking at. Either way. So on that same page, on page 7, it has some other terms that are easier. I took a while to get started, so we'll do these and then we'll take a break. But the other directional terms that are need to know, these are a little bit easier. Distal and proximal always messes people up, and that's okay. So if I'm going towards the head, up. Towards the head is superior. It's kind of known as above, some not like, but we don't. Why do you think we don't just say above or below? What if the patient's upside down in bed? Now above or below changes, doesn't it? If I'm standing over the patient, what am I talking about above? I'm talking about a holy angel hovering above them, or talking about a demon below them? What am I talking about? Okay? But again, when I'm talking about the patient, it's always their right or left. I'm imagining them in anatomical position, so that never changes. And see, now it's universal. So no matter what someone says, if someone says right, we know they're talking about the same right I'm talking about. If someone says superior, I know they're talking about the same direction I'm talking about. So superior is above, towards the head is how I always look at it. The further I get towards the head, I'm getting more superior, okay? So same thing for this woman, like, or for example, for any of us, right? My eyes are superior to my nose, correct? And this is everybody should be this. Because if your nose is superior to your eyes, I would need to ask you a question because I don't know what happened. You know what I'm saying? We're all the same. We all have eyes above our nose, correct? Right? So there are some things that are always going to be on people, but we're talking about wounds. This is why directional terms matter, mostly for wounds or injuries or bruises, stuff you need to keep note of. And you want to be able to describe that correctly where everyone in the medical field, everyone who's had medical terminology and anatomy can read it and go, I know generally where they're talking about. If I just said they got a wound on their left, I've had people do this. People forget their anatomical terms and they say stuff and I'm like, I didn't think that's what you meant, okay? I thought you were talking about their behind and you were talking about their shoulder blades. And I'm like, okay, what are we talking about here? So the terms matter. So inferior is on the way to the feet. And if you have trouble remembering that, it kind of goes back to the old thing of like kings and queens and like stuff like that, right? Like kings are like noble people or whatever. So they're superior. They think they're superior. And peasants are like lower people. And so they're inferior to the king or queen or whatever. Just whatever helps you remember thinking of it. So like the head is like up top. And then the inferior is down low towards the feet. But again, it matters what you're comparing to. Like her knees or my knees are inferior to your like waistline, right? They're below your waist, right? Okay. But my knees are superior to my ankle. You see what I did there? I'm still talking about my knee. I just changed the point of which I was comparing to. If I'm comparing the knees to the ankle, they're superior to my ankles. They're above my ankle. They're going more closer to my head than they are going to my feet. I'm on the way up. That's all it means. That's what I feel like I'm at a comedy club and I'm choking. Are you guys okay? You guys asleep? Is this making sense? Is this going whoosh? Okay. All right. Just making sure. The other ones on there are pretty straightforward, front and back. So anterior, posterior. So anterior is saying I'm going towards the front of the body, and posterior is saying I'm going towards the back, the rear of my body, okay? Again, there's no imaginary line that stops this. So you have to talk about what you're comparing to. The problem with anterior and posterior, always remember posterior, it's sometimes pronounced posterior, but I always like pronouncing it posterior because it helps remember, because I think of like a postscript, post something. What's a post-conference after like a game or something, right? Post-conference is after the games happen. Post means it's happening afterwards, behind, right? Yeah, like post-op. Post, it's behind, okay? So posterior helps you remember I'm talking about behind or towards the back. Anterior is towards the front. Now here's your problem with A&P and stuff. There's every once in a while there's names that have two meanings. And I try to do what I can to say, hey, don't worry about both words, just worry about one. This one is one that comes up too often that you kind of have to know both. And I've even seen recently in medical journals that I've read for my master's just in the last few months where they still use these terms. So they still come up. I mean, they're around. But ventral is a secondary word that still, it means the same thing. It means anterior. Dorsal is another one. Dorsal also means posterior. They're the same. They're synonyms. It's just possibility that someone will use all. And you say, why didn't they standardize this stuff? Again, anatomy and physiology has been developed over hundreds and thousands of years from so many different scientists that Greek and ancient texts and Greek, mostly Greek and even Latin. And so, I don't know. That's why we got double names. But dorsal, I always remember dorsal is back because what does a shark have? What's the thing? Dorsal fin. Da-na-na-na-na-na-na. So that's how I remember dorsal, shark fin in the back. And then the last is pretty straightforward, but superficial and deep is the words we use for something that's close to the body surface and something that's deeper into the body surface, okay? So like my skin, so it'd be like the difference between, like if I get a paper cut, right, you might bleed, but that's a pretty superficial wound, right? If I get stabbed, with a kitchen knife because I said my wife's cooking sucked, that would be a deep wound, wouldn't it? Both mentally and physically. That's a bad example. Whatever. She might one day. I don't know. She cooks fine. But yeah, you see the difference, right? We're talking about deep means, and again, there's not like an exact spot where that there's a difference. There's not like a dividing line in our skin where all of a sudden something's now deep where it's not superficial. Depends on what you're comparing it to. A paper cut is superficial for sure. Is a wound deep? I mean, I guess it depends on what you're comparing to. If you see bone, then I'd probably argue that's deep, okay? But just depends. But all that's talking about is something on the surface level, something going towards the interior of my skin, like past my skin, deeper towards vital organs. And then if you want to understand again with the ventral, like anterior and posterior, torso teres here. I was giving this example earlier this morning, and we'll take a break. But after this. But torso teres, if I can get him over here without, I threw my back out this week. Okay. So torso teres, you can kind of see on his torso, I've pulled out a lot of his organs. Right here where this kidney is, where my fingers, that's his pancreas they're showing off, kind of on the back wall here. Well, our stomach somewhat sits in front of that. So my stomach would be considered anterior, right, to the pancreas. But there's also, my liver sits over top of my stomach a little bit, like this. So it depends on what I'm comparing it to, because the stomach's kind of in between a couple organs. So if I said my stomach is posterior to the liver, that would be correct, right? Because the liver is anterior compared to the stomach, but the pancreas is still posterior. It's still behind the stomach. So it depends on what I'm comparing it to here to talk about positioning, okay? Because right there is a good example where there's like three organs that are all matched together. One's more anterior than the other, and depends on what you're talking about. Out of those options, yeah, my liver would probably be the most anterior of those organs, and the pancreas would be the most posterior. But how you describe the stomach, that's kind of wedged in the middle of those two, Depends on what you compare it to. If I compare it to the liver, it's posterior. But if I was comparing it to the pancreas, now it's anterior because it's sitting in front of the pancreas. So it depends on what you're comparing to. And so that's why these terms matter, is so much. And they're very vital. So what was this? This is a video. I was going to, was there something from this? Oh, I was going to show this off real quick. So again, this is one of my videos I'm going to skip just because of time constraints today because we got to get badges and stuff done. But, oh yeah, there we go. This is a good image of that superficial deep. Can anyone guess what this is a picture of? Just out of curiosity. 10 points to Gryffindor if you can catch. No. The thigh? Does it say it somewhere? No? How'd you guess it? Femur? Too many muscles. All right, fair enough. Yeah, a lot of muscle. It is your thigh. What he's showing you here is this is like this black and white here. That's your bone. That's your femur, your big bone in your thigh. And then these are the muscles all around it. This is like if I did a transverse section. I'd lopped off the thigh and looked down into the thigh. This is what I would see. And so this shows me superficials, right, closer to the surface of my skin. As I get deeper, I get into muscle, or I get into other things. I get into bone. So you would theoretically say, it just depends. It's subjective in the sense of like, I've got to figure out what I'm comparing to. If I'm talking about an infection that's reaching the bone, well, like all the way through all this muscle and all that tissue, well, that would be deep, yeah. But if I had a cut that only cut a few layers of skin, bled a little bit, and it stopped, that would be pretty superficial, okay? So it is subjective in the sense of it's what you're comparing to. And it's going to be something you decide on, but just to help you figure out, you have to know the terms to like make your own assessment of what's deep, what's superficial. And that's going to be different. There might be a doctor that walks, maybe a doctor that was, for a long time was a war veteran and did, field medic. He might think a cut's not, he might think it's superficial when a doctor that does pediatrics says it's deep. It just depends. It could be subjective, right? Other thing chapter 1 does highlight for us is something called like planes of the body or body planes. Not like planes that are made out of people's bodies, whatever. Okay. Body planes is page 8. And mainly what this is useful for is this just talking about how we would look at someone's body as a sectional. Like mainly this is for medical imaging, okay? And some of these will make somewhat sense if you've ever looked at medical imaging, but that's mainly what they're good for is just describing that. But they're worth hearing because they also use these words to talk about the way incisions are and the way things are aligned in those directional terms we use. So sagittal is basically talking about dividing someone into a left and a right side. So where's I don't even know where all my stuff is. Oh, here we go. Left and right side. So that would be basically taking and dividing me like this. Okay, I have a left side now and I have, this is my right, and a right side now, dividing myself in half. And so there's some great images of this. You've seen some of these scans or things like this, like for example of this guy here, this slice right here, I'm looking at a side view of someone's face and their tongue and their trachea and esophagus, all that. This is a sagittal section of somebody. This is what it would look like. This is a sagittal plane, like cross section. That's what I'm looking at. This is how I'm slicing it. I've divided them into a left and a right side so I can see this kind of anatomy of somebody. So again, mainly for like medical imaging, but it's still a term that's worth knowing. If I did that right down the middle, what do you think it's called? Mid-sagittal, right? Midline, mid-sagittal. So mid-sagittal will be right down the middle, like right down the middle where the spine is, the midline is, all straight down, dividing them into that. And it doesn't have to be on the midline. It can be a little bit this way and a little bit that way. These are just slices they use a lot of times in MRIs or CTs, something like that, to see different stuff like that. So that's sagittal, dividing me down either the middle or left to right, but turning me into a left and a right side basically so I can see images that way. The other one is called transverse plane. Transverse plane is going transverse. It's cutting me in half into an upper, like superior half and a lower inferior half basically. Doesn't necessarily have to be directly dividing someone in half, but that would be like going this way, okay? That's a transverse plane. This one's really interesting because if it's in a medical imaging, it's usually medical imaging that is like almost impossible. Excuse me while I take Terry's head off. It's usually kind of really hard to tell what you're looking at. So like, for example, I just decapitated Terry, okay? Poor guy. But in decapitated him, look at his neck here. This is a oh. I'm just kidding. It falls out. This would be a transverse section, right? I have divided Terry into an upper portion and a lower portion. That's transverse. And so transverse images and medical images look very hard to tell what they are. If I look down at his neck here, it's really kind of hard to tell what I'm looking at. I mean, there's his vertebrae, there's some blood vessels and tissue, fat, skin. It's kind of hard to tell what I'm looking at from this angle if you're just looking down here. But that's a transverse section. And so CT scans often do this kind of imaging, slicing it this way. And so the joke is typically a medical imaging that you can't tell if it doesn't look like a human, it looks like some kind of blob. It's probably a transverse section of something. Now I can't get his head back in. There you go. I shouldn't be too rough on them. You don't want to know how much those things cost. You don't even want to know. Okay. The last one is called frontal. It's sometimes called coronal plane, but this is dividing someone into a front, anterior, and a rear section, a posterior or dorsal section, dividing us down like the crown, the top of my head, straight this way. And also torso teres is a pretty good example of this because his whole front here is exposed. Right, his whole front half is exposed so we can see it. This is somewhat of an example, besides his face, like the torso part, is an example of a frontal section. Because I've sliced off the front and I've divided him into a back side and a front side so that I can see his organs. And these images are always going to look more traditional where you see, you're going to see like outline of the lungs and the stomach and all those things, and it make more sense anatomically to see it. Those are the three kind of body planes. And sometimes, again, that frontal plane is called coronal, just because the coronal comes from coronation or crown, because it's like the crown of your head right here. It divides down there. And again, that can be really close to the front or really close to the back. As long as it's dividing me into a front and a back section, that's still a frontal plane. And so again, YouTube video, I'm going to kind of skip around a little bit on this guy, but he's got some good medical images that I didn't bother finding myself because he's got them.
Bones of the vertebrae.
So right here he's showing frontal, and this would be like a frontal CT scan, and you can kind of see stuff that we recognize. Like if you look down there, there is someone's pelvis with their two femur bones, their thigh bones coming up here and here. See that? And you can see some of their spine and some of their internal organs. And so this is kind of what torso teres is, that front slice where I can see images of that view of someone, dividing someone into an anterior and a posterior section. I forget what order he goes in. I think he goes, should know this, I just did this. Sagittal plane. So here's your sagittal, dividing the body into a left and right sections. And you can see on this one, again, that it's showing you see the spine. So this is probably likely a mid-sagittal. It's the division of an image right down the middle. So you can see the spine. You can see some of the soft tissue all around it, that sort of stuff. It's not too, and then he shows you one that's not mid-sagittal, this one. This is still a sagittal cross-section, but now you're missing what? Spine. What was your question? Did you have a question? Oh, sorry. You were. I thought I saw you had a question, and then I didn't think so, and then I thought so again. I don't know. I was confused. Yeah, you see, notice there's no spine in this one. So all that means is this image is moved to the left or right a little bit, where the spine just isn't visible. But it's still just here's the front abdominal cavity, and then lungs up here, diaphragm, some of the internal organs here. So it's hard to tell what you're looking at with these images, and no one's going to expect you to be an image reader. That's for a radiologist, but it's good to know these words, to talk about, to have some context for medical imaging and stuff like that. And again, maybe I'm just a psychopath, which is potential, but I'm always about knowing more information. You need to kind of have the general idea of this stuff so that when people talk about medical images to you, a doctor makes this thing, says something to a patient, you can kind of bridge the gap and say, well, you had a CT scan, so they did it transverse, so they're they ask, I want to look at my image, and you can be like, well, it's not going to help you because it's a slice like this of your stomach, and so they can see details, but you're going to have a hard time telling what you're looking at. The guys that see it every day, they know what they're looking at, that kind of thing. That should be all of them, I think. Oh, and then he shows this one again, another transverse. Sorry, I didn't get the transverse. Transverse is, again, taking me into an upper and lower portion, and this image he had earlier is a perfect example of a transverse section of the thigh. boom, slice. I divide the thigh into an upper and lower portion, and now I'm looking like down into the tissue. Again, it's hard to tell what I'm looking at, but that's transverse, and it's very hard to see. I think you had a CT, yeah. CT of like the head or MRI of the head. Again, transverse. This is like slicing the top of the head with the medical imaging to see all these details. And so that's why medical imaging is so interesting. But that's the planes of the body they can kind of divide people in. Basically, sagittal, transverse, dividing upper lower half, and frontal. So I can see the front of everything. Body regions on page 9. I got great news for you. You don't have to memorize all these or nothing crazy. That's a little bit psychotic. We're not going to do all that. So don't freak out when you see all these. But there are some regions I just want to highlight to say, hey, have you never heard these before? These are something you might want to keep a reference to in your mind. So I would say these are not test questions on Unit 1, but these are a strong, nice to know for the future, for sure. One is axillary armpit here. Y'all ever heard axillary for the armpit? Yeah, maybe some of you that done CNA work would have known what the axillary is. Axillary is your armpit area. The reason some of you may know this as a CNA, you can take a temperature in the armpit. It's usually a little bit colder than body temp. It's not the most accurate, but it is functional enough. I'll write it a little bit bigger. Axillary is your armpit. It's functional. It's not the most desirable. It's like your least desired temperature. Like, I'm just saying, if someone has problems with a fever, you don't want to trust an axillary temperature. That's just bad nursing and bad teching and all the above. You say, well, they don't keep their mouth shut. Well, there's another orifice it'll go. It's rectal. I mean, that's what you got. Listen, if someone has temperature problems, that's where you got to go. You know where you get the most accurate temperature? The rectum. Yeah, that's where you get it. I took care of a lady that came from the ER with a rectal temperature of 96, or no, it was 93 point like something. She wasn't shivering. You know why? You wouldn't know. I don't even know why I asked. You wouldn't know this. Basically, she was too cold to shiver at that point. The reaction of her body had already gone past that point. She didn't start shivering until she hit about 96, 95 degrees Fahrenheit rectally before she started shivering. She was just fine, hunky-dory. Her temperature was normal in the ER 2 hours ago. Sure. Okay, moving on. That's all I'll say about that. No one's temperature drops that fast, in case you're wondering. It's not possible. That means the ER couldn't get a temp on her, and they didn't get one. So, anyway. Disdain. Otherwise, really, I mean, some of these are pretty, a lot of these you've heard of, like abdominal, like we're talking about the abdomen. I assume you would know abdominal is pretty much the abdomen, any of the area around the ribs, or anywhere underneath the ribs, anywhere this, all of us have our six packs, LOL, right? Okay, that area. If you have a six pack in here, I mean, good for you, but stop showing off, okay? Some of us don't have time to go to the gym, all right? And then the other one's the one I circled up top. It's called cervical. That's your whole neck region, is cervical. Does anyone know why this is called cervical? It's related to your spine. Yeah, your spine. You're right. Your spine, the first 7 vertebrae of your spine that make up the spinal column are called cervical vertebrae, or C-spine, whatever you want to call it. But that's where they get the name, cervical. And so they call that whole neck region cervical. We have lymph nodes up there. There's some things that you'll look at in healthcare that's worth knowing. Hey, the cervical is talking about that region. Sometimes they use cervical to talk about some other region that only females have. It's called the cervix. The cervix is your opening from the vaginal canal to the uterus. That's the cervix, and that's also what spreads open and dilates during childbirth. That's a whole nother can of worms. That has nothing to do with the neck. But why they're related in a way, if they sound similar, that's the only way they're related. They sound similar, so people get them mixed up maybe, but cervical is always going to be neck. The collar, the collar they put on people when they have like a car accident and they're worried about them injuring their neck, that's called a C collar because it's cervical spine collar. So those are some of the, on the back side, there's kind of really one I think that is you should know. And some of you are already going to know what I'm going to say, probably. That's a bad A, but it's sacral. This is that region pretty much, with lack of a better term, around the butt crack all the way up above, right there. Why? Because this is like the main pressure point when you're laying and sitting in bed, okay? a lot of pressure gets exerted down right here on your lower back and your sacral area when you sit or you lay in bed. All the pressure of your weight of your body and friction is going to kind of go there. So this is the most common spot that people are going to have wounds open up that are chronically bedbound or chronically not moving around that often. And these can develop fast. I mean, depending on the patient and how well they heal and how bad their skin is, I mean, it could be less than a 12-hour shift. They can go from having nothing to having non-blanching areas that would be considered a stage 1, even a stage 2. So I've seen full erosion in almost to a stage 3 within 12-hour shifts before, okay, if they didn't get moved. Also, things that are common for geriatric patients that you deal with, if they have problems with, going to the bathroom, sitting in urine or stool, that's all bad on the skin. A lot of acids in urine, so it's not good. It's not exfoliating. You don't want that on skin. It's not good for it. So there's a lot of reasons why that region is so important, but that's your sacral area. And but the rest of the body regions, there's just too many. You don't need to know all of them. I wouldn't stress you about all of them, right? All right, back to this. I told you I'd give you an example. Let's see what you think of this. Directional terms. A cut on my leg that is just above the ankle is said to be, now look at your options though. All your options are comparing to the knee. There's your comparison point. So if I'm looking at a wound on my leg that is just above, I shouldn't say above either. What should I say? Superior, you're right. I left that in there for that, I promise. No, I really did. I swear I did this time. It's been like 2 semesters I've left that in there on accident, but this semester I purposely left it so we could correct it. Because you could say above, but again, that's not the right medical terminology. It's not the right anatomical term for the direction you're talking about. You're talking about towards the head, so you're talking about superior to the ankle. So I can see where people are going before we shout it out. Distal to the knee seems to be where most people are going. A cut in the leg that is superior to the ankle is said to be, you think it's proximal to the knee? Here, before we answer, let's draw a foot here. Okay, that's really bad. I don't know. I promise I can draw if I have something to look at. Okay, here's a dumb-looking foot and leg. There's a knee. This is a cartoon Gumby, all right? Here's your knee. Here's your ankle, right? A cut superior to the ankle. So that means it's above the ankle somewhere. And I'm comparing to my knee. Is this further away from the hip, which is the point of origin or attachment, or is it closer to the hip, the point of origin or attachment, than the knee? Is it closer to the hip than the knee, or is it further away from the hip to the knee? That's closer to the hip than the knee is? It's further away, isn't it? That's what the point is. It's comparing to the knee. So I go, okay, here's my knee. My knee's here. Sorry. My knee's here, and it's saying that this cut compared to the knee is distal to the knee. It is further away from the point of attachment than the knee is. It's about what I'm comparing to. If I flip this word and took knee out and said ankle, proximal would be the correct way to say that. Because it is closer to the hip than that ankle is. But I was comparing it to the knee, and that tells me that it is, it tells me that it is further away from the point of attachment or origin. So the correct answer is number 1. It is distal to the knee. It's further distance away from the knee is from the hip. It's all about the point of attachment. That's the key. It's all about the point of attachment and then what you compare to. So the point of attachment, everything doesn't change. That's the knee, that's the hips, that's the shoulders. For the extremities, it doesn't change. The only thing that changes is what you compare it to. And this gives some rationale from the book that's kind of like, not that helpful necessarily. Body cavities is page 10. Page 10. So this one isn't too bad. It's just a little bit, there's just a lot of words here. And so what I recommend for some people is this is a perfect example for me to find another way to study when you guys, if you get mixed up in stuff like this. Because what our body cavities are showing? Well, first of all, what is a cavity? Anybody? What did you hear? When you hear a cavity, what do you think of? space. Here, you probably think of teeth. The technical term for teeth cavities is actually tooth caries. But they are cavities, really. They call them cavities because they eat away the teeth, the enamel in the tooth, and put a hole in it. That's what an infection in the tooth enamel. That's a cavity. That's a caries. But it plunges a hole. It makes a hole in there. So someone said like an opening, like a cavern or a cave. A cavity is just an opening inside something, okay? And so a cavity in our body is just an opening inside our body that contains things. And so a lot of what our body is, they basically divide it into two main cavities with a bunch of smaller cavities within that, and then some more smaller cavities within that. So anytime you get down this rabbit trail of this kind of stuff where it's, well, I have this, and then but these two things are smaller and within it, and then this one thing is even smaller within that, you want to kind of organize it the correct way. So I tell people this is like at least your first example to think about stuff that way. I'm a huge proponent of advocating for finding different ways to study yourself besides reading. And if that means you get tripped up on what cavity goes where, maybe you do yourself a little flow chart, or you do a chart to kind of help you. And so you look at it like, well, there's two main cavities, what they're telling us here. There's a ventral cavity, and there's a dorsal cavity, which is the other names for anterior and posterior. Remember that? Dorsal fin. Then it tells us, well, inside of those fits a couple other cavities. I'm not going to do the whole thing, but thoracic is our chest cavity. Also in there is something called abdominal pelvic. I'm not going to write all up. But you see, but inside that, there might be another cavity. So my point was, this is not the best example. I don't think this is that detailed where you have to do that. But I like to just say, hey, when you get stuff that's like, there's this as the main heading, but then all this stuff fits inside ventral, and then some of the stuff fits inside thoracic, it helps to kind of paint it a different way if you draw it out in like a diagram, or you write it out like in a chart like that. And there is a chart on the bottom of page 10 if it was helpful to some people. This book's all about pictures and charts too. But basically it goes ventral cavity. We have a front cavity. And that means this whole part of the body, basically everything you see here on Terry torso that's exposed, like all this, that's your ventral cavity, the whole thing, okay? An opening that contains something. Right now for Terry it contains nothing, it's just empty. But for us it contains organs. But in that, we can divide it even further. It has like sub-cavities within the ventral, okay? So you have your thoracic cavity, that's your chest. It has a dividing line down there called your diaphragm. And on Terry, it's a little hard to see, but let me see. I always got to remember. Yeah. All these red, the lines right here where my fingers are, this is a big representation of the muscular diaphragm. Does anyone know what the diaphragm does for us? Huh? Helps you breathe? Yep, it's the only thing, really. Without the diaphragm, you don't breathe. It's the main muscle of breathing is the diaphragm. And I would say I would never forget that. I'm going to bring that up again in this class. Diaphragm is the main muscle for breathing, but the diaphragm divides those two cavities, gets thoracic by itself, and below it, they call that the abdominal pelvic cavity because technically it contains two. It contains your abdominal cavity that contains mostly digestive organs, and then contains some stuff down there in the pelvic cavity. For Terry, you can see it. Mostly for everybody, it's reproductive organs, and everybody, male or female, it's going to be the bladder. It's down there too. And also some of our GI, like the end of our large intestine and rectum is going to kind of be technically pelvic cavity. So those two are pretty close. They call them abdominal pelvic, and they separate abdominal cavity and pelvic cavity, but there's no big dividing line like there is for thoracic. Thoracic has a diaphragm that pretty much stops and divides these cavities, but the abdominal pelvic there's no division line here. This is imaginary. There's no dividing tissue line that separates these. It's just about what organs where for here. And then the back, the posterior side, really easy. So the posterior cavity is known as the dorsal cavity, and it only has two cavities within it. Cranial cavity, what goes there, you think? Your brain. And then spinal cavity, which your spine goes there. meaning that there's an opening in the vertebrae that holds your spine, and that's what they're kind of showing here. They're showing they've cut out his spinal cavity basically, so you can see it, this opening here. And again, a cavity is just an opening that houses something. In this case, in the spinal cavity, it houses the vertebrae that make up the spinal column to support us, the skeletal side, and also encased in there's something called a spinal cord from the brain that connects the brain to the rest of the body. So for you guys, it's really just kind of knowing some of the cavities and getting some of the concept of like what I would find in there. These cavity names help because this is kind of a core of the anatomy. You've got to kind of know where to look for stuff. Like I don't want a nurse that thinks my heart is in my abdominal cavity because it's most definitely not. So you're not these are like zip codes, okay? If you are not in the right zip code, you're never going to find the right place to listen to someone's heartbeat or listen to their lungs. So if you look at the front on that next, it's on that same page, page 10. They do show us that technically you can subdivide even further the thoracic cavity. So you see the rabbit trail we're in right now. Because this whole front cavity was called what? Just from that last page. Ventral. So you see like the rabbit trail now, ventral, and then thoracic, abdominal, pelvic. Thoracic has two more cavities, two more openings within it. The one that's in the middle of our two lungs, we have two lungs. In the middle of our two lungs, we have something called the mediastinum. Mediastinum. And all that means in Greek is basically middle sternum. And sternum is the name of the bone that's your breastbone. They're right in the middle. That's all it's really saying. But that whole area is a cavity. In between the lungs is this opening that's surrounded by a membrane, an opening that holds stuff in it. Holds our heart and all the big important blood vessels that come out of it. And then the lungs are on either side, and they get their own cavities, their own openings in the chest, called pleural cavities. And this makes more sense as we talk about these individually, but it's always good to just get advanced and get looking at this stuff so you've heard these words before. But those are all your cavities. We'll do an activity today that should help some of it. Skip that. You don't have to do abdominal regions, but if you look at page 11, you can skip over all the random abdominal regions, mainly just because that gets kind of in the weeds. That's definitely more of a nurse practitioner or doctor thing, in my opinion, where you would need to know exactly what's in every little tiny section of the abdomen. So I look at it like this. Whatever is going to be a part of us as nursing and doing our assessments, we should learn. And so this is one of them. So if you look at someone's stomach, and you just take a line, an imaginary line, and you go from their belly button and just do a plus sign, you're dividing their whole entire abdomen into 4 quadrants. Again, a quadrant's just a piece of 4, one of 4. So we have a right upper quadrant, a left upper, right lower, left lower, and that's based on the patient, the person's right, left, and right, not ours. And so that matters because as you learn some organs, you'll figure out kind of where pain might be. So someone might notice in here, if I have severe pain that's only in my right lower quadrant, there's a very common disease that's very common among adolescent children, young people, and then sometimes older people that you might have surgery for. Does anyone know what that might be? A lot of you knew what that was, appendicitis, right? So you knew that pain down here somewhere on the right side might be indicative of appendicitis, okay? So you see why it's kind of important for a nurse to have some general discussion about that. If you know what organ is where, if they're having pain, you may not have the intellectual ability or the ability to diagnose someone, and no one expects that, but you have the ability to sound the alarm, and that's what nursing is supposed to do. So say, hey, they're complaining of right side unilateral pain. I think they still have their appendix. Maybe we should get a scan and see if their appendix is blown up like a balloon. Say, that's a good idea, nurse, whatever your name is. That's probably, no, I'm just kidding. That's probably what they'll say. But depends on who you talk to. I think doctors have gotten a lot better. Even when I started, there were still some of the old guard left. They were rough. So, but just know, if you have to call a doctor in the middle of the night, I'm just going to tell you, get all your ducks in a row. I mean, I don't like to be woken up. Do you? No? Okay. So make sure you have all the information you need before you call a doctor. Whoops. So body cavity wise, I think that summarizes that for the most part. Again, I'm kind of pressed for time today because we're going to have to get badges and stuff. But again, Siebert, I like him because he just does he draws it while he talks on his tablet.
Starting with the thoracic.
And then he does this too, kind of what we've done. So you need some redundancy, and I did it. It was too fast. It's there. This should be a freebie. Where's the heart located? What cavity is the heart located in? Out of these options. See what you think. Yeah, see what you think for a second. Let some people answer if they want to with a woo clap before. And I would say, too, when we do practice questions, sometimes they're really simple like this, and we're starting off simple, obviously. But I always tell you people to take the time to do them because they're worth thinking through. All right, so most people, we got ventral cavity. Oh, we're even on the people that answered. 4 and 4 on mediastinum or ventral cavity. Anybody want to shout out what the correct answer is? It's mediastinum. It's that cavity in the middle, number 2. The cavity in the middle of the 2 lungs. Now, here's the thing. I can see why some people pick ventral, right? Because look what happens. If I say the heart is located, which means I know what the question's asking me. It's telling me that wherever the next answer choices are, I'm looking for where the heart is anatomically. I'm looking for location of heart. And then I see a bunch of cavities listed. Well, imagine for a second, what if this was not your answer choice? Now, if this was like none of the above, or none of these answers, none. Now what answer choice would you go with? Ventricle, because that is correct, right? If that's all you got to work with, that is correct. So I like leaving this question on to kind of teach a point. The point is, when you're kind of doing testing and you're trying to answer questions, you want to find the answer choice that answers the question the most specifically. Something that's the most accurate, the most specific answer. So yes, ventral cavity is correct. The mediastinum is within the ventral cavity. So to say the heart's in the ventral cavity, you're 100% correct. But you had an answer choice that was more correct. And welcome to nursing questions. This is your taste of them. That is all nursing questions do all day long. But they get way past where we're at right now, and they start throwing in things that you have to make nursing decisions. For example, this is why I leave this question in there to try to think about stuff that's more specific. Priority questions are hard for nursing students to get, and I understand that. For example, you'll get a question where every answer is correct, meaning that every answer could be something you could do for a patient. If you walk in the room and the patient's not breathing, 1, you could run out of the room screaming. Okay, that's one thing you could do. 2, start CPR. 3, I'm like, I don't know. Check a pulse. 4, cry your mom. I don't know. Whatever, okay? But it's about priorities, okay? One thing you're going to do is definitely not leave the room screaming. You're going to at least go to the patient. So you see, you could do some of those things. This is a dumb example. That wasn't a very good example, in fairness. But there's only one answer that's the most correct or the most accurate, specific answer to fit the question. In this case, mediastinum is more accurately where the heart is because that's one of the answer choices. That's all I'm trying to nail home for you guys. So if you're one of the people that pick ventral, you are not wrong in the sense of you're on the right track, but you're wrong when it comes to questions on a test. You're wrong when it comes to questions they're going to ask you in the nursing world questions. They're going to be trying to find you, bridge the gap, and you always want to pick the most specific, the most detailed answer you can for the most part. That's not a 100% rule. There's never a 100% do this every time, okay? It's not like picking a test, you pick C every time, right? There's not a 100% rule that covers everything. But what I teach most people is that you got to kind of go with your gut. You got to read the question and know what it's asking you, and you have to eliminate answer choices. If you've done all that and you're still stuck, then you send it up on a win and a prayer, okay? That's all you got. But if you've done all that legwork, then you should get to the right answer, and you're always looking for the most accurate, specific answer. So specifically, mediastinum is the correct answer, not ventral. If ventral was your only option, then yes, that would be your correct answer, because the rest of them are not even close to being right. They're just not right at all. They're just blatantly not true. Does that point make sense? Does that, yes, no? Does that make sense? I know we're asleep. It's okay. Yeah. All right. I joked with the morning, I'm like one of those preachers that needs an amen. I'm really trying to make sure you guys get this because I don't want to move on with people just zombied out, you know what I mean? Okay, to end it here, page 12 and 13 of the book talks about a concept called homeostasis. And this is something that gets brought up a lot in anatomy, so this is a need to know kind of forever. You can't forget homeostasis. So what is it? Well, the book gives us this definition, this slide. Not my favorite definition. Very like scientific-y. That's not a word, but homeostasis is a state of dynamic equilibrium of internal environment of the body. What does that even mean? Here you go. Here's your simple definition. Homeostasis equals body balance. That's what I would summarize this as, body balance. Because the word equilibrium is a synonym for the most part for balance. So homeostasis is a word we talk about our body's ability to maintain a balance in our world. That's where the dynamic comes from. It's a balance that happens all the time. So right now, in the time it took me just to explain that definition, your body has already done probably a million different micro adjustments. Whether we're talking about temperature, fluid, electrolytes, those kind of things. All of us operate on a range that we're supposed to be. And the best example is temperature, which they talk about on page 13. I think that's the easy example for us to understand. So I joked with the morning group. I said, this is my beaten stick. This is a real human femur. Okay, you get out of line. It's not real. It's not. Why would I have a real human femur? Okay, it's not. I'm using this for an example right now. It's a fake femur from an old skeleton that is no more with us, okay? Maybe it's buried at my house. Don't ask questions. All right. It could be my my oldest child's future boyfriend. We don't know. He won't make it very far, I'll tell you that. Okay. So, to keep this balance in my hand, look what I have to do. I have to move my hand a little bit, right? I can't just sit it here. If I sit it here, I can do that for a minute, but you see I'm slowly doing these little tiny movements with my hand to keep it balanced upright, right? This is homeostasis. I almost hit myself in the face. That'd be funny, wouldn't it? Homeostasis is I'm doing these little adjustments to keep it balanced, right? So here's the temperature example, right? If you go outside, or say like you went outside this morning, it was cool, right? I think it was like 50 this morning. I loved it. Oh, it's glorious. Smell of fresh fall in the air. And I'm not one of those like pumpkin spice girls. I just don't, okay? I hate being hot. I just can't stand it. So anyway, you walk out, it was cold, right? What does your body temperature do? Your body temperature slightly dips down, right, at a range, just slightly. Your body wants to get that back to normal. What does it do? It does a correction to get it back balanced. There's something that has to happen to pull it back. If your body did nothing, what would happen? It would just continue to get cold, okay? Of course, you'd put on a jacket, but your body has to kind of signals and balance it for you. Because I'm talking micro adjustments, okay? 98.6 degrees Fahrenheit is a normal body temperature, but we're talking 98.6666666 repeating. We're talking about micro tiny adjustments in temperature. Our body does all the time. So my body slightly loses some temperature, okay? If I got really cold, what happens when you're really cold? What happens? You start shivering. What's shivering? All your muscles are shaking. What does that do? It generates heat. Movement is always going to generate heat, right? You're always going to be more hot if you're outside doing something than you were just standing there, right? So muscle movement and stuff generates heat. So how's your body fight the cold? It generates heat. It is trying to correct and bring balance back and bring your temperature back to the normal set point it wants. That's homeostasis, those little adjustments your body does all the time. Now the shivering is that, but same thing, if your body temperature went the other way, you got too hot, what do you start doing? Sweating. That's your body's ability to try and cool you down. Same thing, tilt on the scale too far one way, come back. It's just like the thermostat at home. Thermostat at home, do you have a question? Yeah.
So would you say sweating or shivering is like a form of homeostasis?
Not necessarily the whole process is homeostasis. Not necessarily shivering or sweating is homeostasis. It's part of the whole thing. It's part of this whole regimen. Those are things that would happen to us when our body's trying to perform homeostasis. Homeostasis is just the word we use to say the body's ability to keep the balance, basically. If we were out of homeostasis, maybe we have a disease process that's causing us not to be able to sweat. Like we had burns on 60% of our body. Now we lose sweat ducts, sweat glands. So someone that has burns that extensive, they're going to have a lot of problems anyway. But just to say one, we're talking about sweating. Now they can't sweat, so they can still try to do homeostasis. Now they've lost the tool to do it. Their body's still going to try to adjust their body temperature some other way, but they've lost one tool in the tray to do it. But their body's still going to try to do homeostasis. Good question. I lost my train of thought. So the temperature, it's just like the thermostat. That's the example the book gives you on page 13. Thermostat at your house. If your thermostat in your house is set to 70, right? All of a sudden it gets a little bit warm in the house. As soon as that temperature cranks past 70, hopefully, if it goes to 71, then the thermostat sends a signal and says, hey, air conditioner, you kick on. The air conditioner does what? It tries to cool the house back down until it gets back to the set point. Same thing for heat, does the same thing. That's our body doing that for everything. Fluid balance, the number of electrolytes we have, all these things are controlled just like a thermostat. And so, for example, or for the next part of that is on page 13 is where the brass tacks of this is. And so there's this discussion. Don't stress this out too much. It's at the very top of page 13. What they're basically saying is there's some terms they use to describe this, okay? Receptor, control center, effector. I'm not going to stress you and test you on these words necessarily. Sometimes these confuse people. What they're saying basically is that there's something that happens that is a receptor, meaning that we have, somewhere in our body that gets the signal of it's cold or it's hot or whatever it is, all the signals. So there's somewhere in our body that gets sensation and signal that body temperature is dropping, and then it sends a signal to some control center in our body. The best examples are medulla oblongata and our brainstem, but we'll learn about that later. So it does, or a hypothalamus for temperature. It doesn't really matter for you guys right now. They're just saying that signal gets sent somewhere, right? The control center then makes an adjustment that does the opposite of what's happening, right? Because I want my house, if it's getting too hot, I want my house to turn the air conditioning on, not the heat. I want it to oppose what's happening to the world around it. That's what they're saying. They're saying the receptor gets a signal from the world around it. It's too hot, and so it understands that and tries to do the opposite inside the house, or this scenario inside your body, to do the opposite. And that's the effector. Go out and, hey, shiver. Go out and sweat. Do the opposite to cool us down, to heat us up. And so if you look at the bottom, there's something they call, or not the bottom, excuse me, before the picture on page 13, there's something they call negative feedback and positive feedback. So negative feedback is the most common. This is normal. Negative feedback is the, what's the word? Not normal, but most common, I guess. Negative feedback. So we think negative feedback, we think that's a bad thing. We think positive, yay, okay? Well, negative feedback can be good. That teaches us a lot about what we did wrong, okay, guys? So negative feedback is a great thing for our body. That's what we want. Again, what negative feedback says is that, again, I don't like the book's definition, so I try to spend some time explaining it. It says that when an effector opposes the stimulus. So a stimulus is this. The stimulus is, it's too hot in my house. The outside world of my house stimulates the thermostat to say it is getting hot. The thermostat bumps up in temperature. It reads that signal, okay, and sends it to the control center, the thermostat itself, and says, hey, we need to do the opposite of what's happening. It's getting hot outside. We need to do the opposite. We need to cool it down. So it's a negative feedback because it's opposing the direction of change. It's opposing what's happening to it. It's not trying to keep what's happening to it happening. So same thing for our temperature. We don't want to raise our temperature if we're already sweating. Or we're going to continue to try and lower our temperature in any way we can. So we're opposing what's happening to the world around us. That's why negative feedback. And that's why that's the most common thing. They call that a negative feedback loop, where basically I get a stimulus, I get some kind of signal from the world around me. It says it's hot. So then my control center, my brain, whatever it is going to say, let's cool down. And that's the opposite of heating up. And so my body does that until I get back to middle, back to set point, back to homeostasis, the balance. So I'm out of balance, I'm getting hot, start sweating, cool myself down. negative feedback, cool myself down more and more, negative feedback. Now I stop, negative feedback loop is closed because there's no signal getting received that I'm not out of temperature because now I'm in temperature. I'm back in the balance. So there's no more signal getting sent that I'm too cold, everything's hunky-dory. And that's the micro adjustments that happen. That's what negative feedback is. Positive feedback is whenever that effector, whenever something happens, it supports whatever I'm feeling as a stimulus. The best examples of this in the book, it labels one, is actually childbirth. There's a hormone called oxytocin that all of us have. Men have it too, just not in numbers like women do. But oxytocin is released to promote the uterus to contract. It's almost like it starts the process. And then the body, instead of doing the negative feedback, trying to stop it, the body tries to go, oh. So whenever the body reads spike levels of oxytocin, it makes more oxytocin and releases it because the body knows that that is a hormone that's involved most directly in childbirth. So huge levels of it reinforce the body to say, we need to keep doing that. Keep doing that until the baby's out. Now I can stop, go back to normal, homeostasis. That's positive feedback. And that's one of the only examples. 99% of the time, it's all negative feedback. Something around the world around me is changing my balance, and I do something opposite to bring it back. The other example would be blood clotting is an odd one, but blood clotting is an example of positive feedback. Because typically, what do you want your blood not to do? You don't want it to clot, typically, right? Because if blood clots, that means it gets stuck up in my blood vessels. That's strokes, that's heart attacks. That's typically what we don't want. But if I get cut and I'm bleeding, I do want the blood to clot off because the blood vessels are damaged. And so we have the ability for our body to understand that difference by the signal it's receiving. And so it reinforces clot, clot, clot until the job is done, then it stops. Those are really only the two I can think of, but the book really only highlights the one of positive feedback. Everything else is negative. Meaning, again, not a bad negative, a negative in the sense of it does the opposite of whatever it's getting the signal from the world around me. If the world around me says cold, my body's going to try to heat it up. If the world around me says hot, my body's going to try to cool me down until I get back to the middle, the set point, okay? Childbirth. Oxytocin is a hormone that tends to be released and then cause more of oxytocin to be released. And again until the child is born, so. And blood clotting. Yeah, the book does highlight blood clotting if you look at it right before the pictures it gives there. And that's pretty much it for chapter 1. That's negative feedback. So he does the same thing I just did. Siebert does a good video where he uses a ruler to kind of explain it. He gets a little bit more in depth with like some of the receptors and effectors. I don't find using the receptor and effector. I think that confuses you guys more, so I try to avoid doing that. So the body maintains equilibrium through the process of, again, equilibrium just means balance, and I just had it written up there. That one's pretty easy. Homeostasis, that is a word you can never forget. My body maintains balance by homeostasis. So a lot of what our problems are in healthcare is for some reason there's a disease that's causing disruption of this balance. Homeostasis is disrupted, and a lot of side effects people experience that are resulted from their diseases is some kind of interruption in homeostasis, okay? A lot of times, not all the time, but a lot of times.